Part 4, we're looking at IEP, specifically in literacy, more specifically students with reading disabilities, mild, moderate, and severe. This looks at measurable annual goals and short-term objectives. On our parts of an IEP, it's found right there. And remember again, this is addressing an IEP strictly as it relates to literacy. I'm just an old literacy professor. What do I know about this other stuff? But I do know this. You need to have objective, measurable criteria to permit the measurement of students' progress so that you can see they're going from point A to point B. However, don't make the mistake of thinking that measurable only means standardized test scores. There's a lot of things that can be measurable. The goals must be related to part 1, or their specific needs, or their specific deficit. That is why it's so important to have that diagnostic assessment, the qualitative reading inventory, so we can identify the cause of the reading disability. Word identification, fluency, and comprehension. It needs to be one or more of those specifically, and if it's one or more of those, you should have a goal related to word identification, another one to fluency, another, because you address them differently. You can't have just one goal for reading. And again, as I said, they must be measurable goals, quantitative, where you hope the students to be at the end of the year. And again, it can be a test score, but it does not have to be. It could be something simple as numbers of books read. Plop or plaffa, present level of academic performance. Some people, and this is very effective, put that present level in front of each goal. Instead of generally at the beginning of an IEP related to everything, they put the present level in front of the specific goal, and it's just related to that goal. You should have benchmarks or short-term objectives. This is where you break down the annual. You look at that annual goal and you break it down into progressive or sequential steps towards that annual goal. If you meet the little baby steps, the benchmarks, it will bring you there. And it's what you want students to be able to do. Keep it simple and keep it proximal. Far more damage is done by goals that frustrate students. Keep it just a little in front of where they can be. You can have some generic goals, like a score on a test. That's fine. Here's an example. The need is to enhance fluency. There's the present level of performance. So an annual goal is to read that at reading level 4, 60 words per minute. But benchmarks would be first, 60 at level 2, 60 at level 3. Benchmark students will read an average of 2 Mayan books a week. All right, these are all benchmarks to get to there. How will it be measured? Progress will be measured using the Johnson graded reading passages consisting of 200 to 300 words. And most importantly, these are the strategies. Doing these things will get you to there. Doing these things will get you to there. So it not only defines the end state, it gives you the map of the end state, and it tells you how you know when you're at the end state. Remember the 10 commandments of special education. Thou shalt not frustrate students. Do not frustrate students shall thy not do. Honor thy commitment to not frustrate students. Frustration shall ye not rain down upon your students. Students are not to be frustrated. Yoke not frustrations to thy students. No frustrating students. Do not frustrate students, and I really mean it. Really, I'm serious. Do not frustrate students. Those are the 10 commandments. Keep things proximal. Do not frustrate students. Find their current level, get just a little ahead so that they can reach those goals. This is the end of part 4. Part 5 will be looking at description of how progress towards meeting goals will be measured.